It is gnarly, ladies, and it is really common.
As the weather gets colder and people start to gather for the holidays, people start passing around those common diseases, and especially so in schools. Our 90s health expert, Dr. Payal Kohli, joins us now to talk about what you need to know to keep you and your family, your kiddos from getting sick. So let's start with hand, foot, mouth. This went, both of my kids had it, and it is a gnarly disease.
It is gnarly, ladies, and it is really common. So one of the most common viral illnesses under the age of 5 and under the age of 10. They say most kids by the age of 10 have had it at least once, if not multiple times. And so let's talk about it. It's caused by a family of viruses called enterovirus. And what's difficult about this disease is you're shedding and able to spread it before you have symptoms, and for a long time even after you have symptoms, a couple of weeks after. So you can imagine in a daycare where kids are gathering and they're spending a lot of time together, and it spreads by respiratory droplets, by saliva, and by fecal-oral spread, which means if somebody goes to the bathroom, wipes themselves, and doesn't wash their hands but touches something, you can certainly get it from there. We tend to see a spike in the summer and in the early fall. It's a tough disease because the kids can really complain of those painful blisters.
Oh my God, in their mouth. Ava had like these huge sores in her mouth and her hands and her feet. She was like, Mommy, my mouth hurts. It really was a horrible experience.
And you must feel so helpless as a parent. So what can parents do to recognize these symptoms? And I know that the symptoms come almost when it's too late.
Yeah, so it's interesting, exactly what Alex said. This is the classic presentation. Starts out like a cold. So you have a runny nose, you have a sore throat, you're under the weather. That's about 2 days. And then you start to get those mouth ulcers. Now, for anyone that's ever had an ulcer in their mouth, you can imagine you don't have one, but several. So sometimes kids will refuse to eat, refuse to drink, start drooling. And then you can get that characteristic rash on the hands and the feet. This is the blisters. They're not itchy, but they can be very painful and tender. And those blisters are also infectious. So if they rupture, they can actually also spread the virus too. So that can happen. And then they can shed it in their stool for up to 2 weeks after. Oh, wow. So even after all that stuff clears, the rash is gone, it's really important for mom and family members to make sure they wash their hands, especially if they're sharing the same bathroom. But a tough disease, and we don't really have any treatments for it.